Good morning. This is the third lecture in cell injury. On the cell injury, in this lecture, we will discuss the cell injury, the types of the cell injury, reversible and irreversible types, what are the difference in between two, and then it will be followed by the type of the cell death, apoptosis, necrosis, physiological death of the cell, pathological death of the cell, pattern of the necrosis, and so on. So the cell injury, when the normal cells are in a state of homeostasis, that means the cell is in equilibrium with their environment. It's stable. There is nothing happen to the cell. It's okay. It's living in a balanced situation and milieu. The injury that might impose on the cell is defined as a set of biochemical and morphological changes that might occur when the state of this homeostasis is affected by any influence. The cell injury occurs when the cells are so severely injured. Maybe the influence is very severe beyond the cell that could withstand it or tolerate it. It's not able to adapt it. Or sometimes the cells are exposed to the inherent damaging agent. Cell injury can be reversible or irreversible. The difference between reversible and irreversible injury depends on many factors. The reversible injury usually is mild. The following when we remove the adverse influence or the stressful stimuli or the injury, the cell reverts to its normal state, while when the injury is irreversible, it's considered a severe one that the cell cannot tolerate or unable to withstand it. So even if we remove the adverse influence, the cell cannot recover or restore to its normal status. This is a normal cell. This is a cell membrane, this is a cytoplasm, and this is a nucleus. There are many causes of the cell injury. The most important and the most common type of the cell injury is the oxygen deprivation, hypoxia. The most common type of the hypoxia is ischemia. Ischemia means diminished of the blood supply to the tissue and the cell. Chemical agents, including toxins, drugs, and other irritants, infectious agents such as virus, bacteria, protozoa, or fungal infection, immunological reaction, autoimmune reactions, antibodies that develop inside the body might attack the autoantibody that might attack the cell itself inside the body. It's considered also immunological reaction. It's considered also one of the causes of the cell injury, or sometimes the patient might be allergic to certain stimuli that lead to the production and secretion of the IgE, which adherent or interact with the mast cell, the site of the antibody, the IgE, its site reaction at the mast cell lead to the production of the histamine, which cause series of the inflammatory reactions, genetic defect, certain defect, deletion, or trisomies, or abnormal in certain types of genes lead to the cell injuries, or mutations, nutritional imbalances, when there is certain increase in certain lipids or nutrients. Lipids increase in the lipid lead to the hypercholesteremia, which cause damage to the cell, in endothelial cell of the blood vessels, and etc. Sometimes diabetic patient, diabetes mellitus, when there's increase in the sugar, lead also to the damage to the cells in the certain organs in the body, and etc. Physical agent, heat, trauma, frostbites, and the last thing is the aging. يعني التقدم بالعمر also considered as one of the causes which lead to the cell injury. The first one is hypoxia, which is oxygen deprivation. Hypoxia, when there is oxygen deficiency, it's interfere with aerobic oxidative respiration, and it's extremely is most common and important cause of cell injury and death. The hypoxia, low oxygen in the body, might be caused by ischemia, decrease in the flow of the blood into the tissue and organ, due to any cause. Patient have atherosclerosis, have there is something interference with the venous drainage, thrombosis, embolism. It will cause it. So these ischemic changes, which result from loss of the blood supply to the cell, it leads to the hypoxia and decrease or deficiency of the oxygen. Other cause, maybe there is inadequate oxygenation of the blood. When this happened, this usually happened when there is disease of the lung, pneumonia, inflammation of the lung tissue. One of the most serious example that we are encountered and we are living nowadays, and it's considered one of the major problem, actually major disaster and pandemic that we are living in, is the COVID-19 infection, the crisis that we are all over the globe living in. ليش جبت هذا المثال؟ لأن نيمونيا معناها التهاب الرئوي. الكوفيد 19 من أسباب to be more very dangerous and more serious infection. It's infect the lung. It is interstitial pneumonia. It's one of the type of the interstitial pneumonia, and cause damage of the lung tissue that lead to the affect the diffusion capacity of the lung, which lead to the decrease in the oxygen. So when there is decrease or deficiency of the oxygen, the body of the patient that have this inflammation in the lung tissue undergo hypoxic situation. In such a case, it will cause cell injury. هذا مثل احنا عايشين واحنا دنعاني. We are suffering from this pandemic crisis because this infection or this virus is really so aggressive type of the viruses that attack the lung tissue and highly contagious, transmitted in between, spreading between people is really so fast and in a way that we couldn't even imagine it, because it's for certain criteria that the virus has, and also because it's attacked the lung tissue, cause inflammation of the lung tissue. This will lead to affect the function of the lung, reduce or decrease the oxygen or diminish the oxygen, become inadequate oxygenation of the blood because it affect the perfusion, destruct because it's cause injury to the lung tissue. When become this virus cause injury to the lung tissue. This injury to the lung tissue cause inadequate oxygenation of the blood, which lead to the hypoxia. You can see the vicious circle of the injury that might be caused by this virus. The third cause of the oxygen deprivation is reduction in oxygen carrying capacity in the blood. As example, in the anemia patient, low hemoglobin. When there's low hemoglobin, so the capacity of the hemoglobin to carry oxygen is low. In such a case, also there is a reduction in the amount of the oxygen in the blood, and also in the carbon monoxide poisoning, because carbon monoxide form a stable complex with hemoglobin which prevent binding of the oxygen to the hemoglobin. ده سموه بأول أكسيد الكربون. أيضا يؤدي إلى reduction in the oxygen carrying capacity. Chemical agents is the second cause of the cell injury. Virtually, practically, any chemical substance can cause cell injury. Any chemical substance. But there are certain potential active agents like air pollutants, insecticides, هذول اللي يسموها مبيدات الحشريات, carbon monoxide, asbestos, ethanol, sometimes even oxygen at very high partial pressure can cause cell injury. لاحظوا حتى الأكسجين of giving to the patient uncontrolled and unmonitored, it might lead to the cell injury. Drug also considered one of the chemical agents that might cause toxic effect to the cell. Poisons cause severe damage at certain cellular level by increasing membrane permeability, such as mercury chloride poisoning, or by cyanide or super toxic agent, which bind to the mitochondrial cytochrome oxidase. Infectious agent, of course, you know, we all of us, we know that the role of the viruses and the bacteria cause cell injury, and we mentioned this in the previous slide when we had an example, very good example, because we are currently living in such a crisis that make us giving these lectures from this platform. However, we have to, and to prevent us to live a normal life. Look at this small virus. Look, guys, this virus, very small, that we couldn't even see. We couldn't even see by microscope. What make a big difference, very bad difference and impact on the globe, on the earth. All of us, all the countries are suffering from it. The infectious agents can trigger cell damage and tissue injury, like viruses. Bacteria also damage to the tissue, depend on certain factors on bacteria. Ability of bacteria to adhere to or enter the host cell, promote hypersensitivity reaction, and deliver toxin, which are either exotoxin or endotoxin. I think in microbiology you will get through these points in details. But from our pathological point of view, here the infectious agents, virus, bacteria, fungal, and protozoa play a role in cell injury and impact bad effect on and influence on the cell. Genetic defect also because pathological changes, certain congenital anomaly, Down syndrome, trisomy of chromosome 21, sickle cell anemia, all these contribute to cell injury and might lead to the congenital malformations and abnormal looking and outlook of the patient. The other factor that also might cause injury to the cell is nutritional deficiencies, such as protein, calorie, because you know the cell needs normal nutrition. There are a certain level of each, you know, there are a certain level of each mineral and vitamins in the body and nutrients in the body that the cell should get it. If this level become above or below the normal or the standard one, or become sometimes very high, that might lead to toxic effect of this. If it's increased to the level become toxic, it will also cause a cell injury. A specific vitamin deficiency, scurvy and rickets. Excessive, as we say, that of the nutrition also important to cause morbidity, such as in the patient with the obesity, hypercholesteremia, increase in the blood sugar, diabetes mellitus, patient اللي عنده سكري، اللي عنده زيادة في الدهون بالدم، أيضا زيادة الفات بالجسم، البدانة أو السمنة المفرطة، نقص بالفيتامينز، نقص فيتامين سي، نقص فيتامين دي، نقص البروتينات. All of these contribute to the as a nutritional imbalance, which might cause cell injury. Physical agents like trauma, burn, radiation, frostbite, electric shock, change in the atmospheric pressure, also considered as factors that might lead to the cell injury. The last one is the aging, تقدم العمر, because there are cellular senescence which lead to the alteration in the replicative and repair ability of individual cell. It will result in decrease or diminish in the ability of the cell to respond to exogenous stimuli and injury, and eventually to the death of the cell. اعتيادي كل ما واحد كبر بالعمر الخلايا تصبح قدرتها على التعامل مع الانجوريوس أقل ما تستطيع الخلايا تكبر وتقل قدرتها على التحمل وتقل قدرتها على to be adapted or to be withstand this injurious stimulus, and eventually might lead to the death of the cell. The morphology of the cell and tissue injury. All stresses, all adverse influences, all noxious influences exert their effect first at the molecular or biochemical level. The first thing you have to know, this slide is very important because you have to focus on it very well and to memorize. All stresses, all stimulus, adverse influences, noxious influences, the factor that contribute to the cell injuries, exert their effect first at molecular or biochemical level. Okay, but what is lost first? Cellular function lost first before the cell death. قبل ما تموت الخلية، أول ما يتوقف العمل الخلية cellular function، أولا الخلية تعرضت للهايبوكسيا، تتوقف عن عملها قبل حتى ما تموت. نعم بعدها ما ميتة. It's under the effect of the injurious agent or the stress يتوقف عملها. Example of this, myocardial cell. لما يصير عندنا decrease in the blood flow to the one of the blood vessels, coronary blood vessels of the heart. فشنو يصير عندنا؟ ischemic changes. ischemia يقلل blood when to the heart muscle. The first thing happened in the heart, the myocardial cells, that when the blood supply diminished blood to this myocardial cell become non-contractile within 1 to 2 minutes of ischemia, although they might not die until 20 to 30 minutes. تتحمل 20 إلى 30 دقيقة الخلايا القلبية. خلايا الدماغ 3 دقائق 3 minutes. الخلايا القلب تتحمل 20 إلى 30 دقيقة. Therefore we have to make angio to the patient. نسوي له قسطرة catheterization in order to remove or dissolve. طبعا ننطي anti thrombolytic ننطي thrombolytic anticoagulant thrombolytic agents أدوية يعني تذوب dissolve the thrombus in order to restore the blood supply to the myocardial muscle because we have to save the muscle of the heart within 20 to 30 minutes. لكن هذا مو معناها إنه the first function خلال دقيقة إلى دقيقتين توقفت non-contractile. لهذا من الصير non-contractile وين نحس بها وين نعرفها؟ بالECG. من نسوي electrocardiogram حتبين لنا there is something wrong, abnormal, irregular type of the ECG due to the ischemia. قبل حتى ما نشوفها biochemical test. On ultrastructural level, it is seen 2-3 hours later. Light microscope level, after 6 to 12 hours, and on gross examination may be seen after 12 hours. These are the important points that you should memorize because I can guarantee that these points are very important in the exam. The ultrastructural electron microscope changes of reversible cell injury. Plasma membrane alteration, blebbing, blunting, distortion of microvilli, loosening of intracellular attachment, mitochondrial changes, swelling of the mitochondria, swelling considered reversible cell changes, blebbing of the plasma membrane, blunting, distortion of microvilli, loss of the intracellular cell attachment, all of these within the category of reversible cell changes. We are coming here to the endoplasmic reticulum, dilation of endoplasmic reticulum, which is involved in the metabolism of various chemicals with injury, hypertrophy of endoplasmic reticulum, and also later show detachment of ribosome and dissociation of polysome in rough endoplasmic reticulum. In the nucleus, of course, the damage to the nucleus mainly occurs in irreversible cell injury. But there are certain nuclear clumping of chromatin that would happen in reversible cell injury. So, the nuclear changes in reversible cell injury include only nuclear clumping of chromatin. Here are the ultrastructural view of normal microvilli of the mitochondria, of the lysosome and intracellular junction. This ultrastructural view of reversible cell injury. You can see here distortion of the microvilli. If you compare this picture with the picture of the previous slide, you see there's distortion of the microvilli, blebbing, swelling of the mitochondria, nuclear chromatin, clumping lysosomes, and myelin figure. If you can get back to the textbook or to the to the website or to the internet, you can find a better picture than this one. This is a mitochondrial swelling. Look at here. It is reversible. Mitochondrial swelling considered reversible or it is reversible. At light microscopy, light microscope, the microscope that we are using to examine the specimens and the slides. In the light microscope, in the reversible cell injury, there are two patterns of the morphology considered reversible cell injury. Cellular swelling تنفخ تكبر الخلية تنفخ هيك ballooning يصير, and fatty changes. First, cellular swelling. It is the first manifestation of almost all form of injury to the cell. يعتبر the first manifestation of almost all form of injury. What is it? Cellular swelling. يصير cellular swelling تنفخ, because it results of failure of energy dependent ion pump. يصير اكو خلل بالايون pump للبلازما ممبرين, لان ما احنا من قلنا البلازما ممبرين شو يصير بيه بلابينج وبلانتينج واللوس اوف مايكروبيلاي وديستورشن اوف ذا مايكروبيلاي وخرابيط بيصير بيش يصير بالبلازما ممبرين بلانتينج وبلابينج هيك, يعني بلابينج يعني مثل يصير تطلع منه اشياءات وتختلف المايكروبيلاي مالته عن الشكل الطبيعي. شو يصير بها هذه طبعا من يصير plasma membrane. It's very important to maintain the ion pump in the cell. So as a result, there's failure of the energy dependent ion pump, which lead to the inability to maintain the ionic and the fluid. يصير عندنا in equilibrium in between the ionic and the fluid. So it will the cell becomes swollen منفوخة, which lead to the result in accumulation of the sodium and water within the cytoplasm. لهذا تصير ballooning of the cell or swelling of the cell. This pattern of the changes, or it is reversible changes, yes. It is type of the reversible injury, sometimes called hydropic changes, sometimes called vacuolar degeneration, sometimes cloudy swelling. All of these terms are included under the title cellular swelling. Grossly, when all cell in organ are affected, كلها swollen, شو يصير بالorgan يعني؟ increase weight of the organ طبعا لأن كلها تنفخ وتنملي water and sodium. خربطت الايون pump energy dependent ion pump of the plasma membrane, فيصير بها يزيد الايرون الصوديوم والووتر inside, يصير لونه grossly the organ لونه pallor, swollen. الويت مالت الاورجان also increase. Microscopically احنا شو نشوف بالميكروسكوب؟ شلون نعرف انه this tissue there is an injury to the tissue, or there is something wrong going bad inside the cell? We are finding that the cells swollen, حجمها يكبر, واكو there is small clear vacuoles, ممكن small clear vacuoles may be seen within the cytoplasm, maybe small vacuoles, maybe large vacuoles pushing the nucleus into the side. These represent distended pinch of segment of endoplasmic reticulum. This is a kidney in hydropic degeneration. Kidney is heavy, شوفوها swollen and pale. It's not like the normal kidney. This is a normal kidney tubules with viable. Look at these pictures. This is a normal kidney tubules with a normal viable epithelium. Early reversible ischemic injury which show surface blubbing. If you look at here carefully to the cell, we can see there is blubbing in the cell membrane, swelling, increase the size of certain epithelial cells. But in this picture, it is loss of the nuclei with certain fragmentation and leaking of certain contents from the inside the cell into the surrounding structure, which represent irreversible cell injury. This is another picture which from liver biopsy showing hydropic degeneration, clear vacuoles in the cytoplasm of the hepatocyte, which showing enlarged in the size, swelling, which more than the size more than the normal shape of the hepatocytes. And look at here at the nucleus of it. However, it's preserved, but there is certain look like there is certain condensation of the chromatin and swelling of the hepatocyte. This is a type reversible type of the injury in the hepatocytes. The fatty changes, which is other manifestation of the reversible changes that manifested by the appearance of the vacuoles in the cytoplasm as a result of the hypoxic, toxic, metabolic injury, such as in patients with hyperlipidemia or in the toxic effect of certain drugs, certain hypoxic effect of the hypoxic conditions, alcoholic also lead to the fatty changes, diabetes mellitus also one of the diseases that cause fatty changes. It is encountered in the cell which participating in fat metabolism, such as in the liver or as in the hepatocytes or in the myocardial cells in the heart. Grossly fatty changes affecting the liver. The liver usually weigh, the normal weight of the liver is 1.5 kilogram, while here because become heavy, weighing 3 to 6 kilogram. And it's tend to be bright yellow, soft and greasy organ. Fatty changes also considered as reversible changes when remove the toxic or when remove the cause of this changes, it might the liver or these changes might restore to its normal status. Microscopically, the hepatocytes contain minute membrane-bound inclusion called liposomes, which are closely applied to the endoplasmic reticulum. These are microvesicular, which gradually, with further deposition of the fat, these vacuoles fuse to form a single large vacuoles, which filling the cytoplasm, and sometimes these are making macrovesicles, large vacuole which push the nucleus into the periphery, given the appearance like signet ring. تشبه الحلقة المحبس أو الخاتم. This is seen in many type of the situations such as starvation, patient alcoholic hepatitis or alcoholic liver disease, sometimes in diabetes mellitus, hyperlipidemia, viral hepatitis. All of these drug reaction also, certain drugs might lead to the fatty changes. As we said, it is all of these lead to the development of the fatty changes in the liver. This is a fatty changes of the liver in patient with a chronic alcoholic. It is the presence of the large quantity of fat within the liver, which can result in this uniform yellow appearance of the liver section. We are coming here to the microscopical view of the liver. This is a liver cells These are liver cells. These are also liver cell, but this is a fatty liver. This is a big or large fatty vacuole inside the cytoplasm that pushing the nucleus into the side. تشبه الخاتم. Look like signet ring appearance. تشبه الخاتم. This is a microvesicles actually, and this is a big vacuoles or large vacuoles. This is a all of these are hepatocytes. And this is abnormal hepatocyte because there are fatty changes in addition to the enlargement of the size of the hepatocyte above the normal. Here we are coming to the irreversible cell injury, or in other words, it's called necrosis, cell death. Necrosis refers to a series of changes that accompany cell death in living tissue. The changes that take place or occurs in the cell result from the degradative action or the effect of the enzymes. Those enzymes, either from the lysosome of the dying cell, from inside the cell, or from the leukocytes that are recruited as a part of the inflammatory reaction to the dead cell. Because when there is necrosis, there would be inflammation. Necrosis, loss of the integrity of the cell membrane of the cell, of the necrotic cell, which lead to the leaking of the enzymes to the surrounding tissue, which lead to the recruiting or triggering the inflammatory reaction. As a result of this, recruiting of the inflammatory cells, the changes that take place in the necrosis resulting from the degradative action of those enzymes, either from the cell itself, from the lysosome, or from the white blood cells or the recruiting inflammatory cells that are coming or that are accumulation at the site of the inflammation. Necrotic cells are unable to maintain the membrane integrity. So the membrane integrity lost and damaging of the cell membrane take place in the necrosis or in irreversible injury, which is opposite to what happened in the reversible cell injury, when the integrity of the cell membrane almost maintained. However, there is in the reversible injury, there is blubbing and blunting and certain changes, but still the membrane preserved. When there is damaging of the cell membrane in the necrosis, mean that there is subsequently leaking of the intracellular protein and enzymes from the damaged cells or damaged cell membrane into the circulation or into the surrounding structure, which lead to the inflammation of the surrounding tissue, which is not seen in the reversible injury. Some of these protein and enzymes reaching the circulation, which lead to the increase of the certain enzymes or certain protein of the body, which reflecting the necrosis of certain or specific type of the cell. As example, in myocardial infarction, if we do the serum investigation of the certain type of the protein or the enzyme, such as the creatine kinase, which are secreted by the myocardial cell, when there is necrosis of the myocardial cell, this creatine kinase increase in the blood of those patients. In addition to other contractile protein troponin, which are specifically secreted or specifically produced by the myocardial cell. So these two protein or enzymes, when it's increased in patient with the chest pain, suspecting myocardial infarction, that means that the myocardial muscle undergo necrosis due to the ischemia, due to the diminished of the blood supply to the myocardial muscle, which led to the increase of these protein or intracellular component into the bloodstream. The leaking process requires hours to develop. In hepatitis, when there is inflammation of the liver, the enzyme alkaline phosphatase and transaminase GPT and GOT increase also in the serum after the necrosis of the hepatocyte. So these enzymes when increase give us clue to diagnosis that the patient has necrosis or inflammation or whatever the cause that lead to the necrosis of this hepatocyte, because it cause increase of the certain enzymes that are normally produced by the liver cell, but because of the necrosis of the liver cell, damaging of the cell membrane, leaking of these substances into the circulation lead to increase these substance, which give us the clue of the diagnosis that there is something wrong going in the liver cell. By electron microscope, the irreversible cell injury manifested by the following. This is an important point to be memorized. Lysosomes ruptures. There's rupture of the lysosomes therefore there's certain enzymes are released from the intracellular compartment to the extracellular compartment associated with this irreversible injury. Especially it's associated with their fragmentation of the plasma and organelle membrane. So because of the membrane is composed of mainly of the phospholipid, it would be appearance of the phospholipid rich amorphous density due to the damaging of the cell membrane. It is called myelin figure, which is seen in irreversible cell injury. Nuclear changes, dissolution or condensation, endoplasmic reticulum swelling and loss of the ribosomes, mitochondrial dilatation with the appearance of the large amorphous density. In line microscope, the examination of the dead necrotic cell, morphological manifestation or appearance of irreversible cell injury, showing increase in the cytoplasmic eosinophilia. النسيج أو tissue يظهر لنا على شكل لون orange or pink in color because it is stained with eosin. Normally, we stain by histopathological examination. The first stain that we used is hematoxylin and eosin. Hematoxylin give purple color, eosin give orange color. So, because of the binding of the eosin to denaturated cytoplasmic protein and decreased RNA, which caused by the necrosis and damaging of the intracellular damaging of the cell membrane, and because of the leaking of the intracellular component, so it will lead to the increase in the binding of eosin to denaturated protein, and a decrease in DNA lead to the increased eosinophilia of the necrotic tissue. لهذا يبين التشو orange glassy homogeneous appearance than seen in viable cell, which is due to the also glycogen particles losing of glycogen particles appear homogeneous glassy in color, in addition to the increased eosinophilic cytoplasmic eosinophilia. When enzymes have degraded the organelles, the cytoplasm become vacuolated, not eaten, كأنه متآكل ومثقب, not eaten. Dead cells sometimes replaced by whorly phospholipid masses called, as we said in the previous slide, myelin figure, which derived from the damaged cell membrane. This is an illustration, very nice one, of the normal cell and the changes in the reversible and irreversible injury. This is a normal cell. This is an injury. If the injury is mild, we can see here reversible. But if the injury is so severe, it will lead to the irreversible and then death of the cell. All what we mentioned before regarding the electron and microscope, we can see them here, either as a reversible injury or as a irreversible injury. Here there is a swelling of the endoplasmic reticulum and of the mitochondria blabbing. But still the integrity of the cell membrane is maintained. While here, because of this cell, when the injury or the stress or the adverse environment is become beyond the limit or beyond the capability of the cell to withstand it, it will lead to the loss of the integrity of the membrane of the cell. شو يصير بيها بعدين؟ تطلع كلها هاي تنفقع تطق تموت. شلون قال طق وتموت؟ فعلا هي طقت وماتت الخلية، طقت طلعت منها الأشكال والألوان الموجودة، الإنزيمات والبروتينات طبعا الإنزيمات والبروتينات لما تصير حوالين السيل شو تسويها؟ لازم اكو بيها رياكشن، يعني ماكو فد شيء يطلع من الخليه الجسم، يعني الجسم هذا فد شيء مو طبيعي صاير بالجسم. طب هذا certain enzymes and protein مثل ما حكينا يروح للبلاد ستريم، وهذا بالتشو شو يصير هنا؟ يصير inflammation، يصير inflammatory reaction. This is a necrotic. لاحظوا glassy، هذا necrotic hepatocyte in patient with the hepatitis. Loss of the nuclei، ماكو dissolution صار بالنيوكلياي، هذا صار irreversible injury. Necrosis compared with the viable، لاحظ dissolution ماكو nuclei، عبارة عن homogeneous pink masses or cells. This is a necrotic hepatocyte, while here is the viable hepatocytes or liver cells with the nuclei. They are at the periphery of the tissue. This is a central vein in the liver. In nuclear changes, what would happen؟ طبعا هذا السلايد يعني شو اقول لكم، يعني كلش مهم، سهل، يسموه السهل الممتنع. يعني شنو؟ يعني هو سهل انه يجي بالامتحان، لان لازم يجي، لان هذا مش مهم. النيوكليير تشينجز بالirreversible cell injury يعني مهم، والطالب يتوقعه انه يجي بالامتحان لان it's very important، و at the same time لازم تحفظه لان حيجي بالامتحان، لان هو واحد من الاسئله لازم تجي. ليش لازم تجي؟ it's very important. هذا لازم تكون حافظه انت، حتى لو انت جاوبت بالامتحان هذا السؤال وتعرفه هو جاي، هو it is important. الامبورتنس مالته مو لان هو راح يجي بالامتحان، no، الامبورتنس مالته you have to know what would happen, the changes, the nuclear changes in the irreversible cell injury or in the necrosis. اريدكم تعرفوها تحفظوها. A breakdown of DNA and chromatin. breakdown يتكسر. what happened? Pyknosis. There would be nuclear shrinkage, condensation, increased basophilia. طبعا هاي تحفظوها some. DNA condensed into the solid shrunken mass. هذا شو يسموه pyknosis. أو ممكن يصير karyorrhexis. شلون يعني karyorrhexis؟ fragmentation، تتكسر هيك fragmentation of the pycnotic nucleus. We have some pictures to show you and to see all these terms what would be referred to. Karyolysis. What karyolysis mean? In which basophilia, blue staining from the hematoxylin dye of the chromatin, which fade all the nuclear chromatin secondary to the DNA's activity. ماكو مصير breakdown of the DNA because of the DNA's activity, because of the enzymes الموجودة كلها تتكسر بالهذا، فشو karyolysis تتحلل، تصير basophilia, blue staining from the hematoxylin dye of the chromatin that fade all or يخفي كأنه all the nuclear chromatin. This is an illustration of the normal cell, normal nucleus. Here, pycnotic nucleus. Look at the chromatin and look at the size of the nucleus. These are the nuclear changes that are seen in the irreversible cell injury or cell necrosis. This is a karyorrhexis, actually the fragmentation of the nuclear chromatin. Here there is dissolution, karyolysis, chromatin is fade, there is no, كأنه the cell is devoid of a nucleus. Pattern of the tissue necrosis. Grossly, necrotic tissue might be shown or either in the form of coagulative necrosis, as example. Most of the solid organs in the body, the type of the necrosis in them is coagulative necrosis. We are coming to them in next slides, like heart, like spleen, like kidney, etc. Except the brain. In the brain, because the type of the tissue of the brain is specialized. So the type of the necrosis in the brain called liquefactive necrosis, which is seen also in the abscess, accumulation of the pus, localized accumulation of the pus in the organ. Also we see liquefactive necrosis. Caseous necrosis. This is a special type of the necrosis which is seen in tuberculosis, TB, السل الرئوي. The other type of the like caseating, like cheesy material, تشبه الجبن. النكروتيك material تشبه الجبنة. Other type of the necrosis, fat necrosis. Fat necrosis, which is seen in acute pancreatitis because of the degradative effect of the enzyme, of pancreatic enzyme on the fat in the omentum and in the peritoneal cavity. فشي يسموه هذا type of the necrosis fat necrosis. Other type, fibrinoid necrosis, in the autoimmune or in the autoimmune type or in the type of the vasculitis. This seen fibrinoid necrosis in the blood vessels. And the last one is gangrenous necrosis, when there is ischemia of the limb, and this type, special type of the necrosis, it is called gangrenous necrosis. Coming now to the most common type of necrosis is the coagulative necrosis, characterized by preservation of tissue architecture. In this type of the necrosis, the tissue architecture is not lost, it is preserved, in which there is dominant protein denaturation, and the injury also inhibit the enzyme activity, thus block the proteolysis of the dead cell. تبقى محافظ على شكله التشو. هذا من الخصائص للcoagulative necrosis, because the protein denaturation inhibit suppression يصير للإنزيم activity that block the proteolysis, تمنع البروتيولايسيس of the dead cell, فيبقى شكل النكروسيس is شكل التشو preserved the architecture. It appears as eosinophilic enucleated cell which persists days and weeks. نتيجة هذا الديناتوريشن الانجري that inhibit the enzyme activity which block the proteolysis, the dead cell appear, or the tissue appear, as eosinophilic enucleated. There is no nucleus. Eosinophilic, orange or pink colored tissue which might persist for days or weeks. This type of necrosis mostly seen in solid organ, heart, kidney, spleen, etc., except the brain. Example of coagulative necrosis is myocardial infarction, in which the myocyte appear acidophilic or eosinophilic, the same, loss of the nuclei and loss of striation, and eventually the necrotic cells removed by fragmentation and phagocytosis of the white blood cell that are recruiting at the site of the necrosis. This is a coronal section of the myocardial infarction, the left ventricle, patient 44 years old. Look at this myocardial, well demarcated, yellow shape, preservation of the التشو واضح، بس نشوف هنا الكلر مالته مختلف because of the tissue dead. This is another example of coagulative necrosis, weight-shaped kidney infarct due to the kidney infarct, it's mainly due to the ischemia to the kidney. So it's manifested as a wedge-shaped infarct with the preservation of the outline of the here we are coming to the edge, to the histopathological examination or microscopical examination of the infected part of the kidney, while here showing viable kidney tissue. Look at here, however, this is a renal tubule. We are still recognizing and identifying that this tissue is from the kidney. There is no loss of the architecture, preservation of the architecture, as we said, because of the denaturated protein that inhibit the action of the proteolytic enzymes. So it will, so the architecture of the of this tissue is preserved. However, we are losing here of the nuclei, and it appears the epithelial cells lining the tubule appear as eosinophilic. The cell is highly eosinophilic and enucleated, devoid of nuclei, with the inflammatory cells in between. Here is another microscopical view of the coagulative necrosis in renal tubule. Actually, I can recognize this tissue even if there is necrosis of the renal tubules and this tissue of the kidney, but I could identify it as a kidney. Therefore, there is a preservation of the architecture, which are the characteristic feature of the of this type of the necrosis. This is a renal tubules, and this is a necrotic. All of these epithelial cells are necrotic and enucleated because of the loss of the nuclei by karyolysis. The gross appearance of the spleen here, multiple splenic, in fact, wedge-shaped appearance. Look, highly demarcated from the surrounding healthy, viable tissue, which are also the characteristic feature of the coagulative necrosis, which is seen in solid organ as in the spleen. This is the last example of coagulative necrosis, which is seen also wedge shape كأنه wedge shape مثلث كأنه in the adrenal gland, which consider also one of the solid organ in the body. Thank you very much. This is the end of the third lecture of the cell injury, and it will be followed by the other type or the pattern of the necrosis in the next lecture.